We are here in uncharted territory these days with COVID-19 affecting each and every one of us one way or another. That's likely to remain true over the days and weeks ahead. This is a fluid situation that changes rapidly. I used to say it changes day by day, but sometimes it's changing minute by minute. What was true yesterday is obsolete today in some situations. At Essentia Health, we have been working tirelessly to prepare for this challenge. Our top priority is the safety and well-being of our patients, staff, and the communities we are privileged to serve. Consequently, we have implemented several policy changes of late. These include the temporary discontinuation of elective procedures and routine appointments, which will allow us to make the most effective and efficient use of our limited resources. Visitor restrictions aimed at preventing the spread of the virus. These were not easy decisions to make. No healthcare system wants to restrict access and delay care, but we truly believe they are in the best interest of our patients and staff, as well as the community at large. At Essentia, we have launched free e-visits for COVID-19 patients. We had over 300 of them just yesterday. This is the best way for us to screen patients and determine if additional treatment is required. You can also call our hotline at 1-833-494-0836. And I'll repeat that, 1-833-494-0836. And not only do you have an opportunity to talk to somebody, but there's a lot of information on the hotline. There's been much debate over the past couple of days regarding the accessibility of testing. Nationwide, there is a shortage of testing supplies. This is forcing us to be judicious with our tests. That's why it's important for patients to begin with an e-visit or call our hotline. This will allow schedulers to screen for key symptoms, which include shortness of breath, fever, and cough, along with known exposure to COVID-19 and/or travel to an affected area. In accordance with the Minnesota Department of Health guidelines, we're only conducting outpatient tests for symptomatic first responders and healthcare workers with direct patient contact. We can also test people who are hospitalized and suspected to have COVID-19 and those who are symptomatic in groups such as nursing homes or long-term care facilities. We do want to emphasize, however, that if your symptoms are severe and you need to be seen by a doctor, call us if it's not an emergency. We're going to get you in and we will care for you. Obviously, if it's life-threatening emergency, call 911. It's crucial, really crucial, that people don't panic. But we want you to be cautious. If you can stay home, please stay home. I feel like repeating it just like that phone number. If you can stay home, please stay home. If you must go out, limit your interactions to groups of 10 people or less. You've no doubt heard the term social distancing. This virus is spread primarily by respiratory droplets, which can travel up to 6 feet. So we advise you to maintain 6 feet of separation from others, like Dr. Van Deelen and myself are doing right now, at least 6 feet. We also advise you to wash your hands often, cover your coughs and sneezes with tissue or into your elbow, wash your hands frequently, especially after you've touched some surfaces, and you're supposed to do that for 20 seconds. And as I said before, that's singing happy birthday silently or out loud twice. And avoid touching your face, which I know is difficult to do. We all habitually do that, but when you do touch your face, ask yourself, why did I just touch my face? And find out what those trigger symptoms are that forced you to do it, and think about that and try to adjust accordingly. And perhaps just as importantly, be patient and compassionate. There's no playbook for navigating this particular pandemic. We're all learning as we go. We are all in this together, and we're going to get through this together.
Not every patient that's admitted to the hospital with COVID-19 will need ICU care. They will need regular medical floor care. So that's one of the reasons you see all health systems canceling elective surgeries. And what that does, it gives us capacity, hospital beds, to provide for patients that need that care if it's COVID-19. At the moment, so if a healthcare worker was suspected of COVID-19 or diagnosed, the first response would be stay home and recover. And the standard sort of mantra from the health department, CDC, is stay home at least 7 days and at least 72 hours without fever, so whatever's longer. So if your fever is only there for the first day, 7 days, and your symptoms are better, you can return to work, and we'll most likely have them wear a face mask maybe for the total 14 days. Because no one quite knows the the duration of how, when does the contagiousness sort of end. But not every patient that gets admitted for COVID-19 needs an airborne isolation room based on what we understand on the transmission. So if there's someone that's at risk for, quote, airborne related stuff, we call those airborne, generating procedures. If they need to be intubated, put on a breathing machine, if they need to have a bronchoscopy, if they need to get deep suctioning, those sort of things, we would take the appropriate sort of personal protective equipment for those situations. It's not just our health department, it's nationwide, it's even in the reference laboratories. There's a shortage. So that's why we're prioritizing who we're testing. And that could change next week. If the supplies of test kits come up, they may loosen, who we should test. But the measures that we're taking in terms of if we suspect someone has COVID-19 and they're healthy and there's no plans to admit them to the hospital, they can go home, stay quarantined. And certainly if things change, they get sicker, we will reevaluate them and do the test, because that would change the management if they have to be hospitalized. So the previous standard, the goal was we're going to test everybody that had symptoms compatible with COVID-19, meaning the fever, the cough, the shortness of breath, travel history. But given the capacity issues of testing, we've had to pull those plans back. We will still use those because there are still healthcare workers, first responders that need to be tested, and certainly we can use that area to test them.
It's so important that we don't do elective surgery, and why clinic visits that are not essential, we stop doing, so that we have the capacity to redeploy people. The other thing that I would like to say is this is actually a shining example of how the community pulls together, because the schools are canceled. There's need to take care of the kids during the day, and the community through the YMCA and other sources, they're trying to pull together people to take care of the children of our staff so that they can come to work. And I'm just really pleased to be involved in such a community that's doing that. So thank you all.
I think one of the reasons they focused on healthcare workers, first responders, is they may have to go to work to care for people that are sick in the hospital or served for community emergencies. So whether you're tested or not, say as a community member, you're not going back to work, or what your daily activities, you have to quarantine at home. And like I said, this is a situation that changes daily. When the capacity increases, then there'll be liberalization of testing, but it won't change the management or the safety of the patient. Meaning, even if someone came in to the doctor's office and had symptoms, they had a fever and cough, and there's a clinical decision being made, meaning, I think you're well enough to go home, you're going to go home. So whether you had influenza or COVID-19, the recommendation is not to go out for your day job and infect others.
And so I think that each and everyone in the community should really just kind of think of it that any one of you could have COVID-19. Hence, why I'm going to stay 6 feet away from you, and hence why we need to hunker down. So I think it's that kind of messaging that we need to get out there so that people people understand the severity of this disease. We can flatten the curve and get over this much faster. I would like to say, though, how impressed I am with the employees at Essentia, and I'm sure it's the same at St. Luke's, how hard they're working, how in some cases courageous they are, because this is scary stuff. I just want to be right out there. This is scary stuff. And yet they're working hard to take care of our patients, the potential patients that might be coming in, and for the health of the community. So when I see what they're doing day in and day out, I just want you to know that I'm personally inspired.